Welcome after the longer break. You may hear some noise in the background. Those are my doggies that are walking around and playing, so sorry about that. We are going to talk about physiologic jaundice today. Physiologic jaundice is a common and usually harmless condition in newborns that causes yellowing of the skin and whites of the eyes. This yellow coloring is due to a high level of bilirubin, a substance that is created by breakdown of red blood cells. It's called physiologic because it's a normal process that occurs as the baby's body is adjusting to life outside the womb. What causes physiologic jaundice? Red blood cells that carry oxygen and nutrition to all our organs are being destroyed in our bloodstream every 3 to 4 months. After 3 to 4 months, our bone marrow produces new red blood cells. When babies are in the womb, they don't have easy access to oxygen and nutrition because they get everything only through the placental vessels. Because of this fact, babies are producing more of those red blood cells compared to adults to kind of make it up for not having easy access to oxygen and nutrition. Now, when babies are born, they are breathing now, they are getting oxygen through their lungs, they are being fed, and those red blood cells break down as baby doesn't need so many of them anymore, and the breakdown of these cells produces bilirubin that makes skin yellow. Normally, the liver processes bilirubin, which is then excreted through the stool. However, in a newborn's liver is still maturing and maybe not efficient in processing bilirubin quickly, leading to its buildup and causing the skin and eyes to appear yellow. When does physiologic jaundice appear, and how long does it last? Physiologic jaundice typically appears between the first and second day after birth, usually peaks around 3rd to 4th day, and then gradually improves over 1 week after birth. For most babies, jaundice will resolve without any treatment. What are symptoms of physiologic jaundice? The primary symptom is a yellow tint to baby's skin and the whites of the eyes. The yellowing usually starts on the face and moves down to the chest, stomach, then legs and feet. You can check yourself for jaundice by gently pressing either on baby's forehead or nose. If the skin looks yellow when you press, it's likely jaundice. What is the treatment for physiologic jaundice? For mild cases of physiologic jaundice, frequent breastfeeding, 8 to 12 times a day, so every 2 to 3 hours can help. This increases bowel movements, helping to excrete bilirubin. In more severe cases, we need to treat babies with something that is called phototherapy, a treatment where the baby is placed under a type of fluorescent light that helps break down bilirubin in the skin. Phototherapy is a very common and effective treatment for physiologic jaundice in newborns. Now, how does phototherapy work? When light from the phototherapy lamps shines on the skin, it penetrates the skin and is absorbed by bilirubin molecules present in the blood beneath the skin. It leads to a photochemical reaction. The absorbed light triggers a photochemical reaction that transforms the bilirubin from the fat-soluble form, which is not dissolved well in the water, into fat-soluble isomers. Isomer, it's like a mirror picture of bilirubin that now it's easily excreted with the urine. This transformation is crucial because it changes bilirubin into a form that baby's body can more easily excrete. In other words, once bilirubin is converted to its water-soluble form, that isomer, mirror picture, the baby's liver can more effectively process it, and it can be then excreted from the body through the urine and stool. This process helps to lower bilirubin levels in blood, improving jaundice. Now, what are the types of phototherapy? There are several types of phototherapy units that are available, including traditional overhead phototherapy lights, fiber optic blankets that are also known as Billy blankets, and portable phototherapy devices. The choice depends on severity of jaundice, the baby's condition, and obviously healthcare provider recommendations. What is important during phototherapy treatment? During phototherapy, the infant's bilirubin levels are monitored regularly to ensure that the treatment is effective and to determine when the levels have dropped sufficiently to stop the treatment. The duration of phototherapy can vary depending on severity of jaundice and how well the baby responds to treatment. Are there any side effects of phototherapy? Phototherapy is generally safe with minimal side effects. Some potential side effects include dehydration, so it's important for the baby to be well hydrated during treatment. Additionally, to protect baby's eyes from the bright lights, eye covers are used during phototherapy. What about prevention and monitoring of physiologic jaundice? There is no certain way to prevent physiologic jaundice, but early and frequent feeding can support bilirubin excretion. It's important to know that after discharge from the hospital, to go to follow-up visits with pediatrician within the first few days of life to check for jaundice, especially if jaundice was present at the time of discharge. I think we covered most important topics regarding physiologic jaundice. If there are any questions, please contact me at neonatologyforparents.com. Thank you.